I'm Dr. Augustin with Bayside Chiropractic and Rehab. And this week we're going to be talking a little bit about knee pain and knee injuries and what we can do for them. So let's just start by calming everybody. Most knee pain and knee injuries don't require surgery. Even though lots of times it looks real bad and the knee swells up, it has a habit. The knee is very common to swell up and look scary big, but that doesn't mean that you'll require surgery. The most common injuries of the knee are actually fairly minor. You know, one with runners, you could have iliotibial band syndrome, which can cause knee pain on the outside of the knee. And what we do with that, we teach you some stretches, we teach you how to tape your knee, and we also use laser to speed up the process. And if your knee's a little bit rotated or stiff, we may manipulate your knee. And usually in a few weeks that clears up. Some other injuries are slight sprains of the knee, like medial collateral, lateral collateral, patellar ligament strains. And again, most of the time they're not serious. You haven't torn them in half. They do take a while to, heal completely because it is a ligament, which takes longer than a muscle. And again, we use the same type of techniques, teach you exercises, make sure your range of motion is proper and full, and then definitely use laser manipulation to make sure that everything's aligned properly. Now, some other injuries that are more serious would be meniscal tears and ACL damage and inner knee problems, way on the inner knee. Now, they are a little more cumbersome and serious, but again, most of the time they're not complete tears, so we can do a lot of treatment and prevent you from ever having to go to surgery. Another common one is kids have soccer problems. They get what's known as patellofemoral pain, especially in their adolescent years. We use the taping, the laser, and we also teach them exercises to stretch out their quads and their hamstrings to take the pressure off around the patella. And they'll complain a lot about pain, either just around the kneecap or just underneath it. And sometimes the cartilage, when it's growing, is a little softer underneath the kneecap. So what we can do there is, again, we sometimes use maybe a little knee support to keep the patella straight so it doesn't rub up too much when it's sliding up and down the patella, up and down the tibia, and basically prevent too much inflammation underneath the kneecap. But most of the time that clears up, both with that and as they grow older. So most of the knee injuries can be taken care of by manipulation, by laser therapy, some other therapies like ultrasound, exercises, and taping, especially if you're in sports. Now, so knees are very common. Most people go through some kind of knee pain sometime during life. Some other things we use some natural supplements maybe to decrease the inflammation, so you're not taking ibuprofen all the time, and that helps reduce the inflammation and helps with your knee pain. And if you're interested in learning more about controlling or helping your knee pain, you're more than welcome to call me at 251-990-8388 and ask any questions, and I'd be more than happy to answer them. So live happy, live healthy. And again, I'm Dr. Christian Augustin with Bayside Chiropractic and Rehab. Thank you.